So this is a video lecture for the medical, disease, surgical, and lab terminology in veterinary medical terminology course. So first we're going to start with the branches of veterinary medicine. So all of these, well most of these anyway, are ending in an ology. If you think back to your word parts, ology means the study of, okay? So the first two things kind of are a bit of an intro to our next section of the course. It's anatomy and physiology. So anatomy is the study of the structure of the body and the relationship of its parts. So basically, anatomy tells us what does the body look like, what are things called. Physiology, that's the study of the normal functions and activities of organisms. So if anatomy is what does it look like and what is it called, physiology is and what does it do. Next we have pathology. So the pathology is the study of the changes caused by disease in structure and function of living things. So if anatomy and physiology are looking at the normal body, so what are the parts called, what do they look like, and how do they act in a normal situation, pathology is studying them in a disease situation, so where the tissues are damaged in some way from disease. So again, ology is the study of. Path, if you remember, is disease. So pathology is the study of disease. Getting a little bit more specific, if we're talking about histopathology, histo for the word part means tissue. So this is the study of diseased tissues. Etiology, that's the study of how diseases spread and what causes them. Oncology is the study of cancers. And then endocrinology is the study of the endocrine system. So the endocrine system is our hormone system, and we will talk more about that in our anatomy and physiology portion of this course. So moving on, we're going to talk about some clinical procedure terms. These are going to be routes of administration of medications. So a lot of these we've talked about in our abbreviations section, so we've kind of alluded to them, but here we'll talk about them specifically. So first of all, there's two different types of ways of administering medication. So the first is non-parenteral. Non-parenteral medications are administered either orally, rectally, or topically, and parenteral medications are usually going to be injections. So again, maybe word parts will help you here, but enteral, enter you might remember means intestines, and then per or para is near or beside. So if we're saying something is parenteral, we're saying it's beside the intestines, i.e. injection, right? So just into the rest of the body. If something is non-parenteral, it's not beside the intestines. So what we're talking about then is into the intestines, so either orally or rectally, or topically just on the outside of the skin, okay? If that confused you, just ignore what I said and go non-parenteral, oral, rectal, topical, parenteral, injection, okay? So let's break these down, these injections, and see what types we have. So we have quite a few here, you can see. So our first one is intradermal, and you'll notice for all of these, intra, well that one's subcutaneous, intra. We want to make sure we're using the correct terminology here. It's intra, because that means within. We do not want to use inter, because inter means between. So I'm going to go ahead and draw a circle and a line over it. Don't use inter. So intradermal or ID, we remember that from our abbreviations, means between the layers of the skin. So it's actually going into the dermal layer of the skin, which again we'll learn more about in our A&P section. Intravenous is going into a vein. Intramuscular, IM, is going into a muscle. Subcutaneous, so we can use our word parts here, sub meaning below or under, cutane meaning the skin, so subcutaneous is going under the skin. Intranasal, nase is the root word for nose, so intranasals are going into the nose. It's not an injection though, you'll notice. This is just typically it's aerosolized into the nose. So if you have a dog that's ever had a Bordetella vaccine delivered into the nose, or maybe you yourself have allergies and you've used nasal sprays, that's an intranasal medication. Intraperitoneal. So intraperitoneal is going into the peritoneum, which is the body cavity. So it's going into the abdomen, into the space between the organs in the belly. And then intracardiac, cardi, we remember, is the word part for heart. So that's going into the heart. Okay, so general medical terms then, moving on. So anorexia. When we talk about anorexia in human medicine, typically people think anorexia nervosa, which is an eating disorder. In animal medicine, we don't really talk about animals having eating disorders, but we will refer to them as anorexic, meaning that they're not eating. So an animal that's anorexic has a lack or a loss of appetite. Assessment is just another word for evaluating a condition. Auscultation means listening. Typically we're going to listen to the lungs or the heart. We can also listen to the GI tract. So we can hear what's called borborygmus, which is intestinal sounds. Blood pressure. Blood pressure is the tension exerted by blood on arterial walls. You've probably had your blood pressure taken before. With a big cuff on your arm. It's kind of a similar idea in animals as well, so we can measure blood pressure for them too. A contraindication is a reason not to give a test or a treatment. So we've got contra in there, which means against, and an indication is a reason to do something. So if something is contraindicated, it's a reason not to do something. So like a common contraindication you'll see a lot on medications is to not use in pregnant animals. You'll see that a lot on human medications too, to not use or consult with a doctor if you're pregnant or breastfeeding. So the diagnosis, we talked about this when we talked about our abbreviations. If you remember, abbreviation for diagnosis is DX. The diagnosis is the identification of a disease. So euthanasia. A euthanasia is a gentle or an easy death, and I don't mean that it's gentle or easy on the owner. Typically the owner's pretty upset that their pet is dying, but euthanasia is a way for us to make it as peaceful a death as possible for the animal. So we can make it relatively stress-free by sedating them, and then the drugs that we use for euthanasia are basically an anesthetic overdose. So it just puts the animal to sleep and then it does stop their heart. So that's a fairly gentle and easy death for an animal. Okay, so moving on, we got the term febrile or pyrexia. Those are terms for fever. I have another term for you here, and it is hyperthermia. So hyper meaning excessive and therm referring to heat. So hyperthermia is a fever. Febrile means fever, and pyrexia means fever. So for pyrexia, I encourage you to think of your glass dishes that you can put into the oven, or like measuring cups. Those are Pyrex, right? So pyrexia, those dishes can get hot, right? And fevers are hot, they're a high temperature. Chemo Thorax, that's a compound word made up of two root words. Hemo meaning blood, thorax meaning chest. The definition is blood in the thorax or chest. So that's hopefully one that's easy to know because you have your root words in place, right? Okay, so history. We remember the abbreviation for history is HX, right? So history is made up of clinical signs. What does C/S stand for? Clinical signs. V/D is vomiting and diarrhea. Activity levels, how the animal's been eating, any recent changes, signs of pain, etc. The history is basically the stuff that the owner tells us is going on with the animal. Oh, hyperthermia right there is a high body temperature, so another term for fever. The opposite of that would be hypothermia. So if hyper is excessive, hypo is deficient. And hypothermia would be a deficient amount of heat, so a low body temperature. So we talked about the contraindication being a reason not to do the test. Now we have indication. An indication is the reason to do a test or a treatment. So we have the term inpatient. An inpatient is a patient that is in the hospital. So these are patients that we hospitalize for further TX. TX equals treatment. So for instance, if an animal needs IV fluids, we're going to have to hospitalize them and they'll be receiving inpatient care. An animal that needs to have its ears cleaned and then have ear medication, that can be done at home. So we don't need to hospitalize those patients. Our next term is ophthalmoscope. So a scope, right, is an instrument for examining. Ophthalm is the eyes. The instrument to examine the eyes. Otoscope, again, instrument to examine. Ot is ear. So this is the instrument the doctor will use to look inside the ear canal. So the opposite of inpatient then is an outpatient. These are patients that are sent home after treatment. So that's like our dog that came in, had an ear infection, needed an ear cleaning, and is being sent home with medications. That's an outpatient. So our next term is palpation. So palpation is examining by feeling with the hand. So if you've taken your animal into the vet before and you've seen the doctor basically petting your animal all over, they're palpating the animal. So we're looking for lumps and bumps, we're looking for like dry skin, sometimes you can feel creaks in the joints if there's arthritis, you can feel things that are out of place. You can palpate the abdomen and feel like the kidneys or the liver, the intestines. If an animal's constipated, you can feel like all the feces in the rectum. So palpation gives you a lot of information, so feeling the animal with the hands. So physical exam, this is a longer one here. So physical exam, we remember the abbreviation is PE. So physical exam is going to involve the TPR. What was TPR? Temperature, pulse, respiration. So that's kind of like the vital signs for the animal. We're going to look at the patient's weights. We're going to check the eyes, the ears, the mouth. We're going to palpate, so feel. Lymph nodes, we're going to feel the skin, the abdomen, the body, feet, the joints, and then we're going to auscultate. If you remember, the auscultate is to listen. We're going to auscultate the heart and the lungs, and all of that is involved in the physical exam. So prenatal, pre meaning before, and natal referring to birth. So prenatal is before birth. Prognosis, the abbreviation for that guy, PX. The prognosis is a prediction of a probable outcome. So some predictions are very good, right? If you have a broken nail or an ear infection, the prognosis is pretty good that they're going to recover from that with the correct treatment. Things like cancer have a fairly poor prognosis, and an illness that's almost certain to kill the animal is a grave prognosis. So pulmonary just means pertaining to the lungs. We probably know that from our root words. And then we have some abbreviations here, which we have discussed already, PU, PD, and PP. So PU means polyuria, so that means an excessive amount of urine. Polydipsia is an excessive amount of thirst. And polyphagia, phage, if we remember from our word parts, is eating, so it's excessive eating. Often PU and PD go together, right? If we're drinking more, we're gonna urinate more. So radiography, it's ionizing radiation to make a film image. Radiography is X-rays, okay? Easy peasy there. The signalmen. Signalmen is something that VOAs are really responsible for collecting from an owner. It's going to be things like the name of the animal, the species, the breed, the age, the sex, and the reproductive status. So sex is like female or male, reproductive status is intact or spayed or neutered. So signs, those are observable evidence of a condition or disease. So we call these, right, clinical signs. Clinical signs are observable. Okay, so SOAP is an acronym, and it stands for Subjective, Objective, Assessment, and Plan or Procedure, either way. And you might be like, well, what does that mean? Why do I care? So SOAP is a way for doctors to organize their notes when they're writing in a file. So often you'll see these abbreviations written in a file, okay? So S being the subjective, those are things like the history, so the things that the owner talks about. They're subjective because you can't really measure them, right? It could look differently to different people. So sometimes people will, let's say, cut their dog's nails and they cut it too short, and there'll be some blood. And they'll be like, oh my God, my dog's hemorrhaging. There's so much blood. But when we actually see the animal in, it's not really all that much blood. It's just shocking to the owner because they're not used to having to see blood coming from their animal. So that's a subjective observation. To someone who has seen an animal like shot and bleeding out or something, that nail trim is going to look rather, elementary. So subjective is basically the history. The objective is things that are measurable. So these are things like the PE, the physical exam, the TPR, blood results, etc. Okay, so those are going to be like things that we can actually like test for. The assessment is the doctor reaching the diagnosis, and then the plan is going to be treatments, prescriptions, or surgeries. Okay, so this SOAP is just a way for doctors to organize their files. We get way more into this in our office procedures course. Okay, so moving on, a speculum. A speculum is an instrument to enlarge the opening of a cavity. So in humans, if we have to have female humans, if you're getting a pap smear, they use this speculum to do that. So we'll use speculums for kind of similar things. If you need to access the urethral opening in a female dog, you're going to need to use a speculum. A stethoscope, so remember scope, an instrument to examine. Steth is the chest. So a stethoscope is an instrument to auscultate. You're using it to listen. And again, it's that heart and lungs and GI tract. Syncope. So syncope is just a fancy word for fainting. Systolic and diastolic. These are related to ventricles. So ventricles are part of the heart that do, like, they contract. When the ventricles contract, which means they're squeezing blood out into the rest of the body, that's systolic. And this is a type of blood pressure reading. So, usually on blood pressure, you might see like 120/80. This is the systolic reading. It's when there's pressure in the arteries. When the ventricles have relaxed, then we have our diastolic. So that's the lower number, and it usually is a lower number than systolic because it's at rest, right? So those are related to blood pressure. Venipuncture, so puncture just means puncture, so to puncture with a needle. And then vein, if you remember, is a vein. So venipuncture is putting a needle into a vein. Typically it's to withdraw blood. So vital signs, these are parameters taken from an animal to assess their health. So TPR, temperature, pulse, respiration. Also attitude. Do you guys recall 2 different attitude assessments that we had in our abbreviation section? We had BAR and QAR. So those are two abbreviations that mean bright, alert, and responsive, or quiet, alert, and responsive. So I might use those to indicate attitude. If an animal is like pretty out of it, so they're not alert and responsive, I might say that they're lethargic. If they are totally unresponsive, I'll say that they're flat out. So those are our general medical terms. So moving on to some disease terms now. I'm just going to fold this down so we have a clean space here. So when we talk about illnesses, sometimes we'll say that an illness is acute, and we don't mean that it's adorable. Acute means that it's had a sudden onset and a short duration. I'm going to skip down here to chronic, which is the opposite. So acute and chronic are opposites. So whereas acute comes on really quickly, a chronic illness usually has a progressive onset, which means it starts off not that bad, but it gets progressively worse over a long time. Acute illnesses usually don't last very long. They have a short duration. Chronic illnesses last a long time. So for my example here that I usually share, so let's say a person has diarrhea. If it's acute diarrhea, that might be something like, you know, maybe you went out for sushi and it wasn't the best, it kind of made you sick, you had some diarrhea. It came on really quickly, you went to the bathroom a few times, and then it went away. So it had a short duration. Someone that has a chronic illness with, like, say, Crohn's disease, they might have diarrhea that gets progressively worse with time and it lasts forever. That's an illness that they have to deal with and manage for life. So both include diarrhea, but both are very different. So if an animal is asymptomatic, A meaning without or lacking, and then symptomatic meaning that they're not showing symptoms, okay? So asymptomatic means that they're not showing clinical signs. They might be sick, but they don't show an illness. Benign means not reoccurring or not malignant. Typically the opposite of that is malignant, which means that it is causing harm. So like a cancer is malignant. A carrier is an animal that's spreading disease but doesn't have clinical signs themselves. Perhaps you guys have heard of Typhoid Mary. I think this is a really interesting story. So this is a woman, she had immigrated into the US and she was working as a cook in like hospitals. And I guess back in the day, people didn't wash their hands after going to the washroom. And she was spreading typhoid to the people that she was cooking for. But she was never sick with typhoid. So this went on for like much of her life. Like she was banned from working in places, and then she just changed her name and get a job again, and then start making people sick again. In the end, when she died, not of typhoid, they did like an autopsy on her, and she had live typhoid virus in her body. So she was a carrier of that illness, but she was never once sick from it. So I think that's really interesting that you can have the illness and be spreading it, but not show the clinical signs yourself. So that's an interesting story, that one, I think. So we talked about chronic. We can move on to clinical. So we talked already about clinical signs being things that are readily observable. So a person or an animal that is contagious, or an illness that's contagious or communicable, means that it's spread by direct or indirect contact. I think we probably are all pretty familiar with this term now because of this COVID-19 business. So everyone's very concerned about that direct and indirect contact at the moment. We're also very concerned about disinfecting items because of that. So to disinfect means to kill or inhibit the growth of microorganisms on inanimate objects. Okay, so we disinfect a table, we disinfect our grocery carts, etc. Ectopic means something is out of place. Typically you'll see ectopic used when talking about pregnancies. An ectopic pregnancy is one that occurs outside of the uterus. Usually the embryo is implanted into the fallopian tubes. Okay, so our next term is enzootic. Enzootic or endemic means that it affects a constant number of animals in an area. So that means that there is illness, it's present in the geographical area you're referring to, and it stays pretty consistent. So it's not that there's an outbreak, it's pretty consistent and just present in the population. So there are a couple things that are endemic that we deal with in Winnipeg and Manitoba in general. One of those things is heartworm. So I'm sure any of you with dogs probably have your animals on heartworm prevention during the summer. And if you don't, please start. So heartworm is spread by mosquitoes, and there's a pretty constant amount of mosquitoes in Manitoba that are spreading that heartworm disease. So that is an enzootic disease. We also have rabies in Manitoba. So rabies is endemic to our area. Again, there's not an outbreak. It isn't spreading rapidly, but there are definitely a basically constant number of animals that are affected in Manitoba. Another example is Lyme disease in our ticks. So we have a population of deer ticks in Manitoba and surrounding areas, so like Ontario, Lake of the Woods kind of areas, where we end up seeing quite a few animals with Lyme disease as well. So again, it's not an outbreak, but it's a pretty constant amount that are causing illness in our area. So those are 3 examples of things that are specific to the area and causing disease in the animals of our area. So epidemiology. So if we think of ology, that's the study of, right? And an epidemic, think like an epidemic, right? An epidemic is like a breakout of an illness. So epidemiology is the study of relationships determining frequency and distribution of disease. So epidemiology is kind of looking at how quickly diseases spread. Etiology, we talked about this one already. It's the study of the cause of the disease. Hemiplegia, so hemi meaning half. It's the inability to move one side of the body. So hemiplegia can happen after a stroke in humans. And iatrogenic disease, so gen in there, right, is like a beginning or a cause. Iatrogenic is caused by treatment. So you might be like, what? Why would we cause an illness with a treatment? So I have some examples for you there. So if you have an animal that has a disease, like let's say hyperthyroidism. So hyperthyroidism means the body is producing an excessive amount of thyroid hormone. If we want to treat that disease, we need to reduce the amount of hormone that the animal is producing. The animal still needs that hormone though, so we can't reduce it all the way to 0, otherwise we're going to have an animal that now has hypothyroidism, so a deficient amount of thyroid hormone. So lots of these hormone diseases, if we're treating it for being high, we can drive it into being low. Or the flip side of that, if we have it a low one and we're supplementing, we could end up pushing it too high. So an iatrogenic disease is something that we cause by the way we're treating the illness. Idiopathic, that's a disease that we don't know what's causing it, okay? So path, disease, idio, think idiot, right? An idiot is a person that doesn't really know very much, right? So they, of course, wouldn't know the cause of a disease. So an idiopathic illness, we do not know what is causing it. So if something is infectious, it's caused by a pathogen. So look at the word parts here. Path meaning disease, gen meaning like a causing or building. So pathogen is something that causes an illness. If something is non-infectious, it's not caused by pathogens. So an infectious disease, an example would be parvovirus, it's caused by a virus. A non-infectious disease would be like megacolon, so it's a defect in the colon. A lesion is a wound or an injury. Lethal means that it will cause death. Malignant is harmful, life-threatening, or enlarging. Malignant illnesses are usually cancers. If an animal is moribund, it means that it's near death. Typically, they're basically unconscious, laying on their sides and gasping for breath. That's a moribund animal. Okay, so the mortality rate. The mortality rate is the ratio of patients that die to those diseased, okay? So if we have 100 pets that have an illness and 100 of the animals with that illness will die, that has a really high mortality rate. So something like rabies, the mortality rate is really, really high. And then if we have a low mortality rate, so let's say, I'm trying to think of an illness that doesn't really kill animals. I guess like we could say like hyperthyroidism or hypothyroidism. The mortality rate isn't nearly as high as rabies, and we can certainly treat it as well, right? So the mortality rate is how many animals that are sick die. Necrosis, so necra is death, right? Osis is an abnormal condition. Basically, if something is necrosis or has necrosis or is necrotic, it's causing a death of a portion of the body. So one necrosis I feel like I've seen far too many times is animals that get their tails stuck in a door as they're coming in or out of the house, and then the tip of the tail turns black and dies. Another one you'll see a lot, it's kind of a joke in the shelters, not I think a poor taste joke, but cats that have had their ears frostbitten, the ear tips will turn necrotic and then fall off. And then often they'll call them Manitoba folds. So like Scottish folds have the ears that fold down, and then I guess Manitoba fold, that's the joke, is that they don't have the ears. I think it's kind of a sad joke, but you might hear that sometimes in practice. So a palliative is a treatment that gives relief but does not cure the animal. So often people that have animals with cancer elect to do palliative care. So that's what they're trying to do, is just keep the animal comfortable. So they might give them tastier food or like an appetite stimulant, give them pain relief, but unfortunately you can't cure the illness, you're just relieving the symptoms of the illness. A pathogen, we already kind of talked about this, a microorganism that causes disease. Pneumonia is defined as inflammation of the lungs. Prophylaxis is something that you do to prevent, right? So this is a treatment that's preventing disease. So we do vaccines prophylactically to prevent the animal from getting the disease that we're vaccinating for. We use heartworm treatment prophylactically to prevent the animal from getting heartworm disease. Purulent means has pus. So please use the word purulent if something has pus if you're writing in the file. Because if you use the term, so sometimes people want to say, oh, that wound is really pussy, as in it's full of pus. But if you write pussy in the file, that's not really what you're trying to say. So please go with purulent, because that's the more correct term. Okay, so quarantine, I'm sure we're all way too familiar with this term right now. That's the isolation of the sick from the healthy. Remission. If a disease is in remission, it means that we are seeing a partial or complete disappearance of the signs. So cats with diabetes often go into remission with proper treatment, and that's really awesome. The owners can stop giving insulin. Okay, so we talked about disinfecting already. So disinfecting was killing or inhibiting the growth of microorganisms on inanimate objects. If we're doing the same on living tissue, we call it sanitizing. Okay, so think you use a disinfectant like Lysol disinfectant you use to wipe down your tables, but we use hand sanitizer on our hands, right? Also, another term that you'll see is an aseptic. An aseptic kills and inhibits microorganisms on living tissue. So subclinical, we talked about clinical signs being ones that we can see. If something is subclinical, sub means like below or under, we're not seeing clinical signs then. So the animal is sick, but they're not showing the signs of being sick. Subclinical is something you'll see a lot with kidney disease, Lots and lots of cats, like most cats by the time they're old, have kidney disease. A lot of them are subclinical though, because animals don't show any signs of illness in the kidney until the kidney is 75% damaged. So when it's only working at 25% capacity is when they finally start showing clinical signs. So at like 50%, a cat certainly has kidney disease, but they're still not showing signs of it. So they're considered subclinical. An animal that is susceptible is lacking resistance or immunity. So, you know, right now we're all susceptible to the coronavirus, right? Because we don't have any vaccines against that. Those people that have had the coronavirus and recovered, in theory, are less susceptible because likely they've built up immunity. If we, you know, if someone figures out a vaccine for it, then in theory we can all get vaccinated, and then we would be less susceptible to the illness. Okay, so a syndrome is a set of signs occurring together, often from more than one disease process. I kind of make the joke that syndromes are the I don't know what's causing this disease. So again, my example has to do with diarrhea. If you have Crohn's disease, you have very clear signs of Crohn's disease, and they can diagnose you with Crohn's disease, and you can treat Crohn's disease, and in theory, live a better life because you're controlling your symptoms. Sometimes, though, people don't have signs of any clear disease process, and in which case they often get diagnosed with IBS, irritable bowel syndrome. And then they just kind of give you a shrug of the shoulders and say, I don't know, eat more fiber and hope for the best. So syndromes, I find, tend to be, we don't know what's causing it and we don't really know how to treat it, but we'll call it something so that at least you can feel like you have a diagnosis. So syndromes are a lot trickier to treat than an actual illness. So transmission is how a disease is spread from one animal to another. And then there's some examples here in the list. So it can be spread via the blood, it could be sexually transmitted, it could be airborne, it could be fecal oral, which means it's shed in the feces. And then, you know, if you pick up poop, throw it in the garbage, don't wash your hands after, and go and eat a sandwich, you're likely to ingest that disease. Please wash your hands after handling poop. So virulence or virulence is the ability of an organism to cause disease. So some viruses spread disease really readily and they can cause it really quickly. It's like every animal that comes into contact with it will get sick. Other ones aren't as strong or aggressive. So some animals will get sick if they're maybe immune compromised, but a normal healthy animal would be able to fight that illness off. So a zoonosis. Zoonosis is a noun. It's a disease transmitted to humans from animals. If a disease is described as zoonotic, zoonotic is the adjective. So zoonosis is a noun, zoonotic is an adjective you'd pair with disease. So basically, if something is zoonotic, it can spread from animals to humans. And we get way into zoonotic illnesses in like our immunity section. Okay, so that's our disease terms. So moving on to surgical procedures and surgical words. I kind of alluded to aseptic up here. Asepsis, A means without, sepsis is infection. So asepsis is free from infection. Castration, neuter, orchiectomy, and orchidectomy are all terms for male sterilization. So all of those are terms. So again, if we look at our word parts here, ectomy, surgical removal of, orchi or orchid is referring to the testes. Debridement is the removal of foreign material and dead or contaminated tissue, and this is from a wound. I don't know if you can see that all on there. From a wound. So we need to debride a wound to get all that infectious stuff out before we can close it up. You can't just stitch closed a wound with a bunch of dead tissue inside and like road dirt because it's definitely going to get infected. So debriding is cleaning up the wound and then freshening it up, getting rid of all the dead tissue so that you can stitch it closed. A declaw surgery, so D means removal. Onychectomy. Ectomy is the surgical removal of, and onych is the tail, the claws. So a declaw surgery is surgical removal of the claws in cats. So lots of people don't really realize this about a declaw. They think you just remove the nail and it's all well and good. But you have to remove the entire up to the first knuckle. So if we're declawing cats, we're removing all of this, all of this, all of this, all of that, okay? So they end up with just 2 bones as part of their phalanges instead of 3. This is a really painful procedure for cats, and as well, it does not tend to have the behavior benefits that people think it will. They usually want to declaw because cats are scratching their furniture. But what ends up happening is that cat loses that defense of having the claws, and they tend to get really nasty. So they're often way more prone to biting and things like that. So while you might have furniture that's not getting destroyed, you have a cat that's kind of more difficult to live with. Fortunately though, I used to have this conversation a lot with people wanting to have their animals declawed. Luckily for you guys, you won't have to have that conversation anymore because declaws, within the last year, Manitoba veterinarians voted to ban declaw procedures. So they cannot be done unless there's a medical reason for it. Like I had a dog one time that had cancer in the nail of one toe. So we just did basically a declaw, took off that whole thing, and the dog was fine after that. So in that case, it would be allowed, but for the most part, declaws are banned, which is amazing and excellent for cats. So dehiscence is the disruption or opening of a surgical wound. So after it's all stitched up, the Spay surgery, and you send them home with the instructions to not exercise and to rest, and that dog goes tearing around the yard and opens up the incision, that is dehiscence. Often you'll hear an abbreviation of dehis in the clinic. So that wound dehisced. To dissect is to separate or cut apart. And enucleation is a surgical removal of the eye. I always find that's an unpleasant surgery to watch. To excise means to remove. So we excise tumors. And exploratory is a surgical exploration. So we talked about foreign bodies. If you know that an animal has swallowed something and it is in the stomach, we need to do an exploratory to remove the foreign body. So basically, we don't really know for sure what we're going to find or where we're going to find it, and that's why it's called an exploratory. A flank incision. So an incision is like the cut into the body. On the flank, so if you remember from our external body parts, the flank is the side of the abdomen between the ribs and the ilium. So a flank incision is going to be perpendicular to the long axis and caudal to the last rib. So if we have, this is an animal's body, there's the tail, etc. There's the, I'm not great at drawing. There's the other leg. Now I have to see this through. Oof. Anyway, that's a dog. So if we had to do a flank incision, if this is the last rib, caudal to the last rib means towards the tail, and then perpendicular to the long axis, this is the long axis. Perpendicular means it's going through it. So it would be a flank incision on the side like this. Flank incisions, I drew a dog, but honestly, they don't really happen in small animals. It tends to be, I should change this to moo, large animals that this happens with. To incise is to cut into, so an incision is the cut. A laceration is a tearing or a wound. Like lacerate, I think of like a cut. Lavage or flushing is referring to irrigation. That just means running water over a wound or, saline over a wound. So lavage, flushing, irrigation, it's like flushing with water. Okay, so to ligate means to tie or to strangulate. So we need to ligate blood vessels that are bleeding. We need to tie them off so that they can stop bleeding. A spay is another term for an ovariohysterectomy, and that means a female sterilization. So again, if we use our word parts, ectomies, surgical removal of ovary, hyster, uterus. So the surgical removal of the ovaries and the uterus is the female sterilization. So suture has two definitions. It could be here as a noun. So the noun to suture means the act of suturing, so like stitching up. It can also be, oh sorry, that's not the noun, sorry, that's the verb. Silly, this is the noun. So the verb to suture is the act of suturing, and then as a noun, it's the material used to close the tissue or to ligate blood vessels. So it refers to like the thread that you're using to sew or the act of sewing, basically. So we had a flank incision up here. We could also have a ventral midline incision. So the ventral midline incision, so if the dog is, here's the dog's ears and nose, and they're lying on their back. There's their legs, other leg, and their tail. The ventral means it's on their belly, right? And then the midline means it goes right along the midline. So it's an incision like this. If you had an animal that's been spayed, they have this type of incision. And that incision goes through the linea alba. Linea alba literally means white line. And it's the space in between the muscles. So, you know, if you have a person that has, I don't know if you can, yeah, you can see my drawings, okay. If you have a person that has like a six-pack on their belly, right, and you can see all those muscles, the linea alba is the space in between those muscles. It's just connective tissue. So it's easy to cut through and then sew it up. If you cut through muscle, it's a lot more damaging to the animal. So it's all about using that linea alba. Okay, so that's all our surgical terms. And then we have some surgical instruments in this section. So for these, please don't start panicking about having to like recognize like the names of things. Or I mean, yes, recognize the names of things, but don't think that you have to like describe what they look like or anything like that, okay? We will, in surgical nursing, you'll have to identify these kinds of instruments by name, but at this point, we're not gonna have to do that here. Okay, so an autoclave, that is an instrument or an apparatus used to sterilize. So autoclaves use steam, pressure, and high heat to kill all microorganisms. So sterilize, you're killing everything in there. So we use the autoclave for that. That's the most common way of sterilizing in vet clinics. So a bone plate is a stainless steel plate with screw holes that you use to fix a fracture in a bone. So basically it's just like a little plate that you put over the, you know, so if this is the break, you're gonna line those up and put the plate over and then screw it in place. So that's a bone plate. A cast, maybe you've had a cast before if you have had a broken limb. It's a stiff dressing to immobilize a body part. Honestly, we don't use casts very often in vet medicine because they're really tricky to get on an animal. We're more likely to use a splint, which we'll talk about a little lower down. So a drain is a material to channel fluids. So in a wound, underneath the wound, sometimes there is what's called dead space. And that dead space is a liability because it can fill up with fluids. If we close all that off and it fills up with fluids, we're gonna end up with an abscess, which means that there's pus trapped under the skin. It's an infection. So what we do is we put a drain in there, and then that it basically leaves a little hole open in the wound so that the fluids can drip out. And then after 3 to 5 days, when those fluids start to dry up, we remove the drain, and then the animal can continue to heal. So it basically channels fluids out of a wound. Out of wound. A drape or a towel is the cloth arranged over an animal to provide a sterile field for surgery. If you've ever watched TV shows or anything where someone's doing surgery, it's all like those either green or blue drapes all over the person or animal having the surgery. Basically, our goal with draping is to cover the entire animal except for the spot that we're operating on. A dressing is a material to cover or protect a wound, so think like a bandage is a dressing. Okay, so a hemostat, hemostatic forceps. So stat, if something is static, we're stopping, and hemo is blood. So it's something that we're using to stop bleeding. So it's a locking instrument to grasp and ligate blood vessels. So ligate, you remember from up here, is to tie or to strangulate. So this locking instrument basically kind of looks like a scissor. And it has these little, it's called a box lock, where they click together and then they won't pull apart. Then they've got